It's time to get geoing, so pull up a chair and join us at our kitchen table for golden opportunities. Your money or your health. That's the way it can feel sometimes when it comes to figuring out healthcare coverage. Jim Lineweaver is here to help balance your wealth and well-being when deciding on a plan for you and your family. Jim is a certified financial planning professional with the Lineweaver Financial Group. Welcome back to the show.
Good morning.
Should price be the primary factor in determining your healthcare coverage?
I personally wouldn't use that because you could have the cheapest plan in the world, but if it doesn't pay when you have a claim, what good is it going to do you? So price is a factor though, but what I would really look at, are my doctors in the plan and what providers are there? And also, if something really hits the fan and you got to get some emergency treatment or have some surgeries done, what hospital are you going to go to, and make sure it's the one that you want to be seen at.
Okay, now we've all heard about the insurance plans through the Affordable Care Act, the Obamacare stuff, that you get to at healthcare, is it healthcare? Yeah, healthcare.gov. Yeah. But you're saying that there are some health plans that aren't even on the website.
Yeah, there's actually called on-exchange plans and off-exchange plans. So all the exchanges that have been set up out there, there's one in every state, and they're either operated at a federal level or at a state level. Ohio happens to be at a federal level. But what ends up happening is you don't necessarily have to go with those plans. There can be other plans, even from the same insurance company. You just got to be careful about the bells and whistles that are in there because you're really going to have to read the fine print.
Okay, wow. So what are the primary types of plans that are available, on or off?
Yeah, well, what happens is whether you're on or off the plan, they have to have essential health care benefits. And some of the things that you would normally think about is it going to have hospitalization, and it has to have prescriptions, and it has to have emergency room visits and maternity and all those types of things. So those are basically going to be the same across the board, whether you're on an exchange plan or off an exchange plan.
And then there's the metals.
There's all the metals. So, you're going to target bronze and silver and gold and, get a platinum level. So you're going to be able to go in a tier plan to say, how much of a quality or a Cadillac of a benefit that you want to have. And you can pick and choose those. And it helps to disseminate all the benefits, too, for comparison.
They just get more expensive as they get bigger.
But you also get more benefits, too. So, and less deductibles and out-of-pocket expense. So there's always a trade-off.
So how do you choose between on-exchange and off-exchange?
Well, this is where you really got to look at your individual situation, not only how much you can afford, but if you know what hits the fan, how much benefits you're going to get. And then what I really do is they can provide some pretty good details, so you just line them up side by side and really look down through some of these nuances to see what's most appropriate for you.
The premiums, though, right?
Well, no, and the benefits. Yeah, and the benefits. So you got to look at it, because you could have the same provider, with kind of the similar benefits, but when you really dive into the coverage, they could be totally different. Like if you had some type, if say you had a family and you had some pediatric medical care or dental care that had to be done, one plan on the exchange might require to go through those providers and everything, and you could have an off-exchange plan where you could maybe have something more independent and coordinate with your medical plan, and it might be a little easier to jump through the hoops and get those medical benefits covered.
Okay, but how about the premium rates?
Yeah, they can only base it based on four things. Okay, your premiums. It's going to be age, it's going to be your geographic area that you're in, your family size, and then what everybody should not be doing, but tobacco. So if you're smoking, they're definitely going to ding you with more premiums, but at least that's something you can control.
All right, on exchange, off exchange, cost, coverage. It's very confusing, but you have help, right? Seminar.
We do. We have a whole education program in a lot more detail than we discussed today. So it's coming up on March 17th at 6 p.m. and also Thursday, March 19th at 1 p.m. at our Valley View office, and there's no charge to any of your viewers to come.
All right, sounds great. Healthcare coverage can't be on again, off again. It can't be that kind of care. To help you understand your options and whether an on-exchange or an off-exchange plan would be best for you, attend Jim's seminar or give him a call. The number's next.
For more information, call the Lineweaver Financial Group at 1-888-313-4009 or visit www.lineweaver.net. Next.